I would like to now introduce our next speaker, Dr. Samresh Shrivastava, who is currently working as a consultant ophthalmologist at Raghudeep Eye Hospital. His special interests lie in the management of cataract and refractive surgery. He also has a keen inclination to the understanding of the optics of the eye. He is the associate editor of the Faculty of Thousand Journal, the associate editor Cataract and Refractive Surgery, and a reviewer at multiple international journals. Over to you, Dr. Samresh.
So again, thanks a lot to the IRSI Youthful Wing. I mean, it's so good to see young faces, taking up the baton now. I'm going to just follow up and I'm going to keep it tight as much as I can in the interest of time. So this is not regarding, I mean, there is going to be a little bit of repetition because obviously we're discussing junior surgeons and residents. But having said that, I think there's a lot for us to understand and learn as we move on. What I have learned is an amalgamation of, now it's my 9th year into private practice. So I'm not that old, but I'm old enough to share what I've learned across over the years, starting my journey at Mohan Eye Institute, where I started with my foundations, then moving on to Shankar Nethralaya, eventually with Dr. Busavada at Raghudeep Eye Hospital, and finishing up my fellowship at Narayan Nethralaya under the guidance of Dr. Rohit Shetty. The one thing that I think one needs to understand, and I think most surgeons, senior people in the meeting today will agree, is you have to get the basics right. If you don't do it right in your residency or your early formative years, you are never going to get it. Like I struggled with a lot of things, but some things for which I'm thankful to my institutions are basics of doing indirect ophthalmoscopy, of picking up a gonio and trying to figure out early on what things are, doing things like confrontation fields, a proper slit lamp evaluation. I think as a resident doctor, we are all inclined on, getting down to practice and having that prolific cataract practice, and we see all the surgeons talking, but we sometimes forget to understand that it's the basics that will get you to be a good surgeon in the end. And something that I cannot emphasize upon more. When I say basics, it's you have to understand that there is no shortcuts. If you really want to be a good surgeon, you have to be a good clinician, and you have to pick up everything that you find along the way, and you cannot disregard small things like doing investigations and basic investigations on your own. Manual keratometry. A lot of us, a lot of the residents and fellows in good tertiary centers don't get to lay their hands on machines because they get everything done by technicians. I insist on all fellows who are at my institute and all people who come and observe with me to at least lay down their hands on machines and learn the art of things like immersion, because these things are your backup plans, they are backup strategies. And only if you do it yourself will you understand how these machines work. And it's not only the high-end machines, but also simple things like refraction. And not only refraction is something I struggled with, because in my post-graduation, refraction was something which was not for us to do, but it was for the optometrists to handle. Not only simple refractions, but refractions in real-time conditions, like simulating, like working on a laptop, working in dim lighting conditions. These are things you would rather do in your post-graduation or early years of practice, because if you have a control on this, then you control your practice. You understand what the patient's problem is, and you can give the patient a desired outcome. On the other hand, if you depend on somebody else or a technician, your practice is always going to be sabotaged by somebody leaving or somebody asking for a higher hike on fees. As early on in practice, one thing that I understood well and is very important is to invest wisely. You in your post-graduation days, you always have limited resources. So buy yourself good equipment. Good equipment doesn't necessarily mean buying the biggest phaco machine or the best phaco machine. It means buying the best small things, buying the best lenses, buying a good torch that will last you your life. I have a Maglite that's been there for the last 10 years that I still have in my pocket, works very well. And using scleral depressors, buy the best of the lot, because this is what is going to guide you into deciding what you're going to do with the patient. Don't compromise. Compromise is something that starts early on and becomes a part of your career. And I think with the smallest things, one should not compromise. This is where you lay down your foundation. Moving on, it's as we all know, this statement has been overused in our life. Devil lies in the details, but I think you cannot overemphasize this at all. You have to observe your doctor, the person that you are working with, the person who's mentoring you, not only in terms of what surgery he's doing, but everything, right from behavior to the dressing sense, to how they're interacting with the patients, to their body language, to everything has to be picked up. And this is the skill that one needs to pick up in the early years. Surgery, like Dr. Uday brought about, you will learn when you do a few surgeries, and if you're willing to learn, it's not your first or the 20th surgery that will teach you, but your 100th or the 1000th surgery which will make you even better. But these are the skills that if you don't pick it up in your residency or early career, you will probably not be able to pick it up because you'll be left alone to learn that on your own. And that brings me to a very important point. And I think conversation or talking to the patient, how you're talking, how much stay time you're giving, how much of effort you're making to understand the patient's problem and to explain the problem and solutions to the patient will make the biggest difference in your career eventually. And I think that is something that you have to really pay attention to. More in COVID times, because that's probably all you can do right now, is pay attention to how conversation will help. Moving on to surgery. I think we had too much of incisions for the day, but I'm just going to show you this video. This is a trainee surgeon who's doing a single plane incision on a high-speed camera. And you notice how he's shivering. You know, the tremors are so visible also because he knows he's being recorded. But what's the catch is not the small things that, like I said, it's not the going in the eye, it's the coming out. He enlarged the incision from a 2.2 to maybe a 2.4 or a 2.6 the moment he came out of the eye. Notice again. Because he never paid attention to it. And there are many reasons why this can happen. Compare that to a, an experienced surgeon. I'm not going to show you this video because this is how a good incision is going to be done. And I think Dr. Uday, Dr. Suvir have brought it out. The important thing is if you do not do incisions well, again, Dr. Om Prakash, Rohit Om Prakash brought about the fact that your side port is often that, steps on, this is the side port that's leaking because it's a poorly done incision. So we are so engrossed in our residency on doing a rexis and doing a chop that we forget that it's the small things that will make the big difference at the end. And I think that's why it's very important to observe each and every step of the senior surgeon who's with you. Not only observe, I think if you get an opportunity, assist. And I think Rohan, thanks for bringing this point up. I was missing this in the morning. You have to assist. If you don't assist, you don't know what the next steps are. You're not intuitive. You don't lay down your trolleys and you're going to, if you don't know how to prime the machine, it's going to come up to you at some point in time. So I think it's very important to do that. Learn to calibrate all your equipment on your own. Not calibrate, if not calibrate, at least check the calibration. Because this is something nobody will tell you. Only the technician sitting in that quiet room in the corner will know. But you have to go inside and pick that person up and ask him to teach you calibration. Because you're not in this whole ophthalmology for a short run of your residency. This is a long struggle. It's a long life. What you pick up early will lay the foundation of what you do later. Again, like Dr. Suvira said, get your ergonomics sorted out. This is, this is a 1FR. This is what I trained on. And I didn't realize the problem that I was facing, struggling with my neck posture until I started operating on a better microscope, where I could have a better posture, get my neck in order, and far more comfortable surgery. It translates not only to your comfort, but translates to your surgical performance at the end because you feel so much more comfortable. You do a far better job. This is Dr. Mayuri at our clinic who was, notice she's using a chair with a backrest, gives her immense support, good control on the arms, so that she can do her fine movements much better than here, one of our other surgeons operating with a slouch. You're going to land up with disaster at this point in time because your spine's in a very crooked angle. You can't do this for life. So you have to understand. There have been enough articles showing that ophthalmologists are the worst affected after a few years of practice is because we ourselves screw our own skeletal system. So again, when it comes to that, invest in good equipment, invest in a good chair. Anyway, you must have operated on a stool, but get away with it now and buy yourself a good operating chair. Again, I'm not going to discuss foot pedals, but observe how the surgeons are using their foot pedals and get your ergonomics on that sorted out. A very important thing that sometimes we forget and we're not taught in life is that you have to understand that it's important that the ergonomics are not only good for the surgeon, but they're also good for the patient because it's the patient's ergonomics that are crucial to your surgical outcomes. If the patient is not comfortable in the OR, you are not going to be comfortable because the patient's going to move, the patient's going to fidget. So spend some money, get yourself nice gel pads, get chairs that are ergonomically oriented. Make sure you talk to the patients, not only in the OR, but also on the slit lamp, and pay due attention to their ergonomics because it is them at the end who are going to promote you. So make sure they are comfortable in the OT. Again, observe. Record, I think I'm not going to discuss this in detail because everybody has discussed this many points in time today. But make it a habit to record all your videos. Pay good attention. And I'm just bringing about this case to show you that, this is also a recording. At the end of the day, if somebody, one of our colleagues trying to implant an Ozurdex, and obviously it's his first time, so you can notice the shake. But because he's not centered, even in the operating microscope, he implants the Ozurdex. There goes the Ozurdex. And notice what he's done. He's caused a big PCR with an in-the-bag IOL. So it's very important not only to record, but to also look how you're recording. Pay due, diligent attention to centration, making sure your eye is stable. It's the small things, because if you look at your own videos, you will know how fidgety you've been in the surgery or how rock steady you've been, and all this will translate down to your surgical performance. Stay in the field and keep things focused. I use a screen which is right across my operating microscope, because every now and then I peep out of the operating microscope to look at the screen and look at my focus and centration, or my technician is aware enough to keep on, guiding me. When we look at surgery videos like Dr. Devgan's website, it's important that you can learn from your own experience. I learned so many things by doing mistakes again and again, but I think it's very good if you can learn from somebody else's experience, your senior surgeon's experience. Look at their videos and try not to make the same mistakes again and again, rather than doing it on your own. One more thing which is sometimes overlooked is the importance of having neatness in your practice, in the way you dress, in the way you present yourself, not only in the way you are, but also in the way that your clinic is, makes a lot of difference in the patient's confidence in you, or the patient's confidence, because they understand that if you are neat and clean in your environment, you are going to be neat and clean in the way you do a surgery, and their confidence definitely builds up. And that's how I'm just showing you pictures of my clinic to show you how I've picked it up from all these centers, and I'm trying to translate it into my practice now. One most important thing is for us to not accept everything for their face value because the doctor is saying it's the way it is, but to question everything that is being taught to us, because it is this question that is going to drive us to understanding that if we don't start questioning and start understanding, doing a research and publishing, we have not made an impact into the system into this healthcare system. So if you really want to be good, you have to pick up habits of questioning and trying to find answers to these questions early in life. Try to write, try to publish articles, try to present, and try to make posters, whatever is feasible. But don't give up and don't get commercialized and step down with practice at the first go. Again, I'm going to run through fast on doctors who are early on in their practice. That when you're buying equipment, and you will be buying equipment, don't look at a machine and how big or how expensive it is. Look at things that are important. Look at support, how good a support structure of the equipment is. And when I say support, it's not only support in terms of breakdown or technical support, but also clinical applications. Because you will not learn everything in your residency. Some things will have to be taught in the clinic when you're operating in your private practice. And a clinical applications, or a person who will sit on your head and will tell you how the machine is performing, will always come to good help. And also good companies will help you with practice development and help you promote yourself and help you promote your practice. The machine breakdowns can always happen. So it's always a good idea to negotiate a good annual maintenance contract at the beginning. No, we don't really know about this. So I learned this the hard way, but it's important for all of us to understand that it's very good to negotiate and learn from your seniors and take their guidance in buying a machine. Just to show you, this is my dad's phaco machine, which he bought probably in the early 90s when I was still in my medicine. This is universal too. And I can still do a surgery on this because it's still as robust, although they don't give an AMC for this anymore. Buy machines which are future proof. I bought a LASIK which just got upgraded. So you have to look at machines that are future proof. But please don't fall in for peer influence. Just because somebody says it's the latest or the most in thing or the latest fad in the market, don't go for it. Try it out for yourself if you can, or go to a place, or go to doctors, go to senior surgeons who will be more than happy to have you as an observer. But please do not just listen to your peers on conferences and just buy a machine, because you might burn your fingers then. Small things. Life is always about a team approach. Your practice is not going to be good if you don't team up early in life, even in your residency. Acknowledge your seniors. Acknowledge the fact that you've learned things from your seniors. So when you present somebody's video, when you present somebody's article, it's very, very important to acknowledge them, because it builds up a good camaraderie and it builds up a lot of respect. And I just wanted to bring about, I was trying to look for that Ophthalmology Times article from the Dr. Uday Devgan during my PG. I couldn't find it, so I looked this up on YouTube, because at that time we didn't have those videos, but I still have his Ophthalmology Times Phaco that helped me pass my postgraduate exam. So thanks a lot, Dr. Devgan there. Choose your path of your fellowship and your life, but just take your own time in doing it. Don't rush it up. You don't want to start being, having a mindset of being a retinal surgeon when you're in your first year PG. Learn and then pick it up. Support your colleagues, because you're going to be working together later in life, and don't try to compare yourself or say that I'm better than the other person. Support your colleagues, because this is a habit you have to learn early on. Exercise, because that's what's going to keep your mind healthy. But the last thing that I want to bring about, and Dr. Rohit already said this once, is if there is a choice in life, there is a choice between quality and quantity. Forget about the number of surgeries. You do that one surgery right, use the best consumables, use the best of equipment and deliver the best outcome. You will have patients at the end. Quantity is something where you'll always land up with a compromise. Thank you so much.
Thank you so much, Dr. Samresh. At this point, I'd like to introduce Dr. Anshika Luthra. She is on our panel. She is currently a PG resident, and she has a few questions to ask. And of course, she'll be thanking Dr. Samresh for a wonderful talk.
Thank you so much, Dr. Samresh, for those valuable pearls. As residents, we'll definitely keep them in mind and inculcate them in our learning process. So I just wanted to ask that amidst this COVID crisis, we as residents are getting very limited hands-on surgical exposure. So how can we better cultivate our surgical skills and dexterity in this present scenario?
So I think that's a great point. There's a big problem actually right now. The fact that you will have less patients, and whatever patients there are, the doctors will be very, very wary of having a complication. I think also is a good opportunity to acquire skill sets in wet labs, because you will still have goat eyes available or artificial eyes available. And because there is ample time right now between you and your mentors to sit down with them and to evaluate each step. If you cannot do a real surgery, you can always practice steps. Small things will matter. Look at their videos. If you're recording, if you're not recording, buy an iPhone adapter and start recording, so you can sit and discuss. But also discuss the finer aspects of practice, like I brought about, of counseling, talking, the art of using special skills like indirect ophthalmoscopy, because this time will never come. Use it as an opportunity rather than a problem at this point. And you'll realize that surgery you will learn, because the world is going nowhere. Cataracts are going to be there. So I think surgery is going nowhere. You will learn the surgeries. Don't worry about that.
Dr. Suvira, ma'am, any comments on that?
Every day I go to work and my residents also looking at me like, what today? So what we've done, what I've done is, because for me, it's such a strong need to nurture them. It's always been that. So now what we've done is we invested about last year in a Kitaro. So since residents start learning with manual SICS cataract surgery, it might be well worth trying and get your department to get you a Kitaro. It's a Korean thing, which it's a model of a rock solid eye, and it gives you silicone strips which look like the limbus. So the ability to learn tunnel making, and it costs hardly 2,000 for about 30 of them. So every month I give each of my residents about 15 of those each. So they're making 15 scleral tunnels. We give them sutures, brand new sutures, because no one is suturing SICS. No one's doing it. Only the seniors are operating. We're only doing phaco's. There's no training going on. So we get them to have sutures, and all the students are learning. This is only the surgical part of it, because at the end of the day, no residents are happy if they don't do some kind of surgery. So for the first 3 months, we did not even let them watch, because we didn't know the dynamics of what was safe in the OT. Now, with any paid SICS and phaco's or pterygiums and traps, we are getting all the residents to go turn by turn in batches of 2 and observe the surgeries. And they're actually being taught to them. They're actually being shown each step slowly. And for they themselves, they are learning hand-eye coordination. They are learning suturing. The cornea fellow is learning. The eye bank is just about chugging along. So there are a lot of eyes that are not being used. They are learning suturing on that. I think that's how we are managing. And there is a lot of time, as Samresh, you just said, to focus on other things. So diffractions, manual keratometers, immersion scans. So even though most of them are done on lens star, we're still teaching them immersion scans. They're learning to use the lens star, counseling, consenting, looking at paperwork, making sure, and now they're starting to come and tell me that, okay, this patient is got with the rule astigmatism, again, understanding toricity. There's so much time when they're not stuck with managing 30 CAM cases in the evening, that they are able to pick up a lot more clinically with us. So they are also being posted with each of the seniors, and I've told them for the junior students, 25 cases to be discussed in detail in the OPD. So that way we are keeping it going, their enthusiasm and our own, I believe.
Dr. Pranav, Dr. Aarti, Dr. Lubna, ma'am, any comments on Dr. Suvira's and Dr. Samresh's talk?
I would just like to say, we have seen Dr. Suvira ma'am, she is one of the pioneers in training in Mumbai. Ma'am, you very well said that, the correct mindset and the attitude is more important, because comparison is thief of joy,
Yes.
So comparing what your colleagues are, what their learning curve is. Rather concentrate and focus on what, how your training is going on. I think that really helps. And I really love that sentence, one sentence which you said, is that it really takes efforts to create a nucleus drop.
Yes, it does.
So yes, just be a little bold and be brave, and I'm sure everything is going to be fine. And when it comes to Dr. Samresh's talk, it's always wonderful to listen him speak. One very very point what you made was to know how to handle machines, because we as surgeons, we are so concentrating more on clinical aspect that if suppose we are asked to calibrate a machine, it's something that we would our hands would jitter. So it's really equally important for the young ophthalmologist to understand how to handle each and every machine, respect the tissues, and I'm sure that there's a long way to go.
I feel Suvira ma'am made some wonderful points. Just to add to that, we could what we have done is we have engaged our trainees in getting to know and encouraging them to know the nuances of sterilization of the OT, to work in the CSSD, to learn about packaging of different instruments and sterilization, and more so, like it was said by one of our speakers, that assisting the a senior surgeon also makes you helps you learn a lot. So maybe you won't get to operate or something, but you could always learn or encourage your trainees to learn how to load different kind of foldable lenses, get them demo videos, and then they can help you load the lenses that you are going to implant in your private cases. So if you really want to learn, there are a lot of avenues, and just working in the OR for some time with the OR technicians helps you to learn. I think sterilization, I feel, is very, very important, especially if you want to go and have your own setup. So there are many avenues where, like Dr. Anshika was asking, there are a lot of places where you can build up your foundations besides just operating on patients. Also, A-scan, I think working in the A-scan room helps you to understand what kind of flaws you would get if you are tilting your probe while performing the A-scan, or where would you prefer an immersion, where would you not. And so there are a lot of aspects to cataract surgery, just besides just surgery. So I think you have got a golden time to work on this, which is usually hurried up by all the other training.
I would just want to reiterate what Lubna ma'am said. I think when I started, the good thing about our college was that we were the ones who had to assist our consultants, our head consultants during phacoemulsification. And when I started here, I was only doing small incision cataract surgery. And slowly we used to get like irrigation aspiration by manual, or just fold the lens and just put the lens inside implant it inside the bag. So it was like with small steps that we learned, and especially during assisting, you learn how the professors handle all the complications, and what they usually take, and what they usually how they progress throughout the complications, and how to manage how to manage the nucleus, and how to do a trench. And I think assisting is very important, and it really helps you eventually. And also, like, watching videos and recording your videos is one thing which is very important for PG residents.
A quick question from the audience to the panelists. The question is, how quickly should one jump into private practice?
I think Dr. Uday and Dr. Rohit, Dr. Gaurav and Dr. Mehta sir can answer that. They are the pioneers of private practice. So over to you, sir, for this question.
Well, in my career, I think the important thing is you're going to keep evolving your practice. And so I finished my training immediately, started a private practice, which was at the beginning, the first 5-6 years, I did everything. I'll do strabismus, glaucoma, diabetic laser, cataract, general eye exam, refractions, everything. And then over the years, you keep evolving it. So now for the last 10 years, I only do cataract surgery and refractive surgery, and that's it in my private practice. And so that you can evolve this, it just takes time. And then don't be afraid. In the US, I'm brown and I have a funny name. But you know where I set up my practice? In Beverly Hills. The best of the best. Because I have one secret weapon. I don't mind working twice as hard as anyone else. I've never been the smartest, but boy, no one can outwork me.
The best message that anybody can give is this: you can't stop working hard. The biggest thing is success and the confidence that you have in your own self. What he said was, it's an ever evolving process, even till the last day that you're a surgeon. After doing 100,000 cases, 100,001 will definitely give you heartbeats, which you'll miss. You know, all your coronaries are going to get hardened by that. So there is no overlearning, underlearning. Every single day, if you're ready to learn. And that's where, Dr. Suvira's presentation was wonderful. That caterpillar reminds me of Richard Bach saying that there is no such thing as a problem without a gift for us in its hands. We seek problems because we need those gifts. And that the mark of our ignorance is the depth of our belief in peace and injustice. And what the caterpillar calls the end of the world, the master calls it a butterfly. So what she said is, to become a butterfly, there is a long way. There is no going back. You don't have to be sorry about anything. Be confident. Start your practice the day. You got to cut the cord somewhere. You have to cut the cord. And the day you cut the cord, you will start growing on your own. You're still learning. You're not cut off from anything. You're still learning. You're still going on every which way. Because the more and more you're dependent you are, the more and more you're not going to be cutting off from the cord. And it will go on and all. And unfortunately, medicine, by the time you're 30, half of his friends, the investment bankers in New York, are planning to retire by 30, 34. And most of the physicians, most of the surgeons are starting up their practice by 30, 34. They're not even started their practice. So that is the big difference. It's the long haul. Medicine is a huge long haul. It's not getting a Ferrari on day one. It's not settling down in Beverly Hills and driving past those LA lanes on day one. But the confidence that you can do it is what keeps you going, and that's the way to go about it. Everybody makes it. There's no question about it. Just have strong determination and start your career fast. Get on moving, keep learning, and keep learning from your failures too.
Perfect. Perfect.
I think coincidentally, fortunately, or unfortunately, whatever way you would like to put it, I was forced into practice the moment I passed my MS. But then I personally feel that I was slightly premature into it. I think the moment you feel that you're confident in completing the surgery, cataract or refractive, whatever you're into, that is a time when you can easily jump into it. So that is the first thing which I would like to say. And you have to believe in yourself. And when do you become old? When you are closed. So don't be closed, go on improving, and that's the click to it. So the moment you feel you're confident, but that is the time when you can definitely start.
So I think we've got some amazing pearls from all of you, and I completely agree with many of the things that all of you have said. And frankly, following residency, it all depends on how confident you feel at the end of residency. I know of people, at the end of residency, they feel they've picked up all the skills of patient communication, and they're able to pick up good skills. If you've been in a good program, you've really done well with surgery, there should be no problem actually getting into a practice. But today we also see that most people would like to probably specialize or learn into something, and maybe want, because once you get into practice, you're probably not going to go back, learn new skills anyway. So if you haven't picked up many of the skills, I think it's good to go for a fellowship or even a senior residency. Maybe probably not do 2 or 3 years of that, and maybe just a year, and whatever interests you, maybe go and do something about it, and then get your skills right. And then once you feel more confident, as Dr. Rohit said, once you feel confident offering surgery to your patients independently, it should be good to go ahead and get into practice. So don't be scared of getting into practice, for sure, but be confident about when you're about to start, that you will be okay with your patients, and make sure of that. Now, other thing I picked up, Uday, was exactly something what you did. When I finished, I didn't do a fellowship. I did a few years of senior residency, and then started practice doing buckling and strabismus and DCRs and entropions and cataract. And I learned phaco because it wasn't being done when I was doing my residency. So I learned phaco myself. I just knew SICS. So I learned along the way, and as you did over maybe 7-8 years, gradually realized that my favorite thing was cataract and refractive, and probably just went into that. I still get to see some of my old buckles, and I'm amazed 20 years back that I was actually doing some retina surgery. But that's how you can, as you go, you keep learning, and then you can evolve as a surgeon. And I think private practice is not, it does not stop your process of learning at all. You keep learning all along the way, you keep specializing, keep going out for programs, and keep picking up new skills. Never stop evolving as a surgeon. I think that's probably what helps you keep going in practice as well. Always keep looking up to something new to do, and keep learning every day with something else. So I think these few things would probably is how I would summarize that.
Gaurav, I'll just say something very interesting. During my time of residency, intracapsular cataract was there. Extra was just coming in. And IOL was like, by the time I finished residency, were a few IOLs. So everything that I learned in residency is not what I'm doing anymore now.
Absolutely.
If I have to say, everything that I've learned and I'm doing now is everything outside my thing in my private practice. So phacoemulsification, microphaco, my manual phaco, whatever, your LASIK surgery. 91 LASIK got, 94 LASIK got approved by the US FDA. And I was with the first trials in Houston when it was started in 1991. So imagine, it's a lot of things are going to change, man. It's just a different world which is going to be there next 10 years, and with AI coming in and all. So don't think that this is the end of the world. You have to keep learning and changing. Nothing that we did 5 years back or 10 years back. If you're doing the same thing, then you're not at the right pathway. So you keep changing and you keep evolving.
And I really loved what Uday said about working hard. I think there is no substitute for hard work. There is one thing: you can be brilliant, you can be smart, you can be intelligent, and you can be highly skilled surgeon, do what you want. If you're not willing to work hard, you're not going to really excel at what you're doing. So I think that's such an important message for all the young people out there.
For sure.
I think one last thing, if I'm permitted to speak, is that you have to, you have to see as Samresh has rightly put in, I would put it in one word, that you have not to treat the cataract. You have to treat the man with the cataract. So how you handle, when, there are so many friends of mine who happen to go to Gaurav, and I'm not saying it on your face, and I mean it. Your handling of patients is immaculate. These things have to be inculcated. You have to learn from your mentors how they handle the patients. Handling is one of the most important thing which one has to learn. This is not that that it's a quality, how you assess, how you understand, how you acknowledge. All those things are the most important things which have to be learned side by side. Because if you have to learn, get into the private practice, no doubt you are evolving as a surgeon, but evolving as a human being and in dealing with the patients, that is a very important click in the whole scenario.
Dr. Rohit, our admiration is mutual, I think. I keep learning and keep hearing from the patients that, sir, you should go and see in Amritsar how Dr. Rohit, his management of the hospital, and how well they kind of administer the thing. Patients don't waste their time, and, please go and see how they do that. So I think that goes. And Samresh, what a beautiful lecture. I think for the youngsters, you gave a tremendous, in those 5-10 minutes, you just did a fantastic job. And I think the take home message for all our residents and young people would be amazing from all the pearls you said. I mean, Suvira did a great job with the FACO training things, and Uday, of course, is the best teacher around. But Samresh, your talk for the residents at least would really, mean a lot, I think. Yeah, wonderful.
So thank you, Rohan, and thank you, Pooja, and Dr. Anshika, and all the young, and everybody. Tushar, that was a great performance. We've seen you doing it again and again. Aarti, thanks for being there. Dr. Uday, they weren't taking your time, and I was watching him, listening to the other speakers. He did not disappear into the OR. He was keenly learning even now. If you rest of the people saw this, something very important. He was trying to pick up points even from the other speakers at this time, even from Samresh and whoever was speaking. This is something which everybody has to learn. Every talk you go to, keep learning. There is everybody who has to teach you something or the other. And that is the beauty. He kept smiling, he kept nodding, and I could literally see he was picking up points. And that's how the beauty of the whole thing is. And a very well planned stuff, that how to start life. It's not that bad. It's confusing. You don't know what's happening. It's foggy. When your career is just starting, you don't have the right equipment. But invest in the best equipment. Don't use a used blade. Use a new blade every time. Make a good incision. Don't take cut corners. It's simple and it's there at your fingertip now. You can have joint practices, group practices. It's a long way ahead, but it's a beautiful journey, and you will thank yourself for being an ophthalmologist in this lifetime, because the amount of blessings you get from a good smile after a great surgery is phenomenal. Dr. Suvira, thank you so much for taking your time out. And you've been always a gem for all the students. You know, we've been watching you, all your students who have come out, and they are always, always praising you. Your freedom, your clarity of thought, your teaching across the country is lucid and brilliant. And you're so nice with them. You call them bachas, and I've seen you calling them bachas, and they grow up with you. And very clear. We like that clarity of mind which you have to tell us exactly what is there in your mind and what we should be dealing with, how we can progress. Thanks everybody, and Rohit, thanks for being there till the end, and of course Gaurav, always the strong backbone of IRSI. Thank you. I cannot thank you everybody more than that, and being there for everybody. And Ashok and Navneet always, and Anupam being there to support us to have that live stream going on so well. Thanks very much. Over to you, Gaurav.
Thanks, Dr. Himanshu. And, I would really like to congratulate our young team under the guidance of Dr. Himanshu for having pulled this off in a fantastic way. Of course, you've already thanked all the speakers, so I will not do that again. But on behalf of the IRSI executive, Dr. Amar Agarwal, Dr. Maipal, Dr. Himanshu, and all the others, we have a big executive committee, and all of them are equally enthusiastic. And, it's a great moment today that we have the young wing of the IRSI, actually on the move today. And I really look forward to some very interesting new faces and younger people chipping in with their ideas. They're all full of the best ideas, and I would really put across that if people could send in their ideas about what they would like to see or hear, and what they would like in their programming, what more things they would like the young IRSI members to cover up, it would be really nice. And please send in your feedback and what you would like to see more often. And thank you all the faculty for being here today and sparing time, precious time, and giving out these amazing pearls. Over to you, Rohan.